Well, the junior doctor situation is completely contrived. It was never a negotiation. There was always the threat of imposition. There was never any new money. The doctors were not arguing for a pay rise, and there are no new staff. But what he wants to achieve is to break the unsocial hours payment so that the assets can be sweated. So when the private companies take over, they can abuse their junior doctors. But as a helpful side product to what they're doing is to push out doctors, to save on redundancy and to replace them with a down-skilled workforce, a cheaper workforce, a more compliant workforce who will be more willing, perhaps, without the ethical binds that doctors have, to overlook what will be far less quality care. We were turning medicine into conveyor belt medicine. The focus of the private corporations will be for quick, easy, cheap, profitable activity. So they want to close down more A&Es, they want to close down more ITU units, and having a workforce crisis which they have created will also help their argument to shut down more. But you won't necessarily need to be medically qualified to be issuing medical advice, and this is the toxic undercurrent to all these reforms.
Well, general practice has been on the ropes for a decade. We've been calling for, pleading for, demanding for investment to save our service. This deal is that investment. 35% of extra resources to be delivered over the next 5 years, and with a state-funded indemnity scheme thrown in for good measure.
But with an expanded team, the risks of indemnity increase. For GPs, indemnity payments had become unsustainable, and this year, in England and Wales, we have finally been able to tackle this. Once and for all, we have taken away the burden of...
Please make a note of this date, 26th of June 2019. This is a pivotal day where the GPC has betrayed general practice and betrayed our patients. What the contract they've done and presented as a fait accompli in undue haste shows hope over experience. What is required to take us to the next step of the Americanization of our healthcare, they have dutifully delivered. Pooling of capitation budgets. That's what the primary care networks do. What will happen over time is the incremental ratcheting up of the diversion into what is an ACO, a HMO. These are all American-style organizations built on the need to generate a profit. We already had public statements about the need to reduce GP surgeries from 8,000 to 1,500. Getting rid of the corner shop model as it has been described by Simon Stevens. The shared savings scheme has been copied and pasted from a document from United Health dated 2012. This will remove autonomy. We are being asked to supervise our own replacements. The solution for lack of doctors is more doctors. It's quite rational and logical. It's not to go along with what the government is proposing. This is as toxic as the Health and Social Care Act 2012. When our respect has gone, when the patients are going to look for scapegoats, they'll be looking in our direction. And it's not you guys, it's our leadership who are misleading us and taking us down a very dangerous road. Quality will go. You'll have non-doctors making dangerous decisions, as we already have within the hospital setting. Other non-doctors discharging patients who are sick. Yeah, they're making clinical calls they are not qualified to do. And in terms of avoiding avoidable
Dr.
admissions...
Gill, if I could ask you to... Do you finish your sentence, please,
Okay,
Dr. Gill?
Vote for this motion or you will regret it, and we will regret it as a profession. Thank you.
Incompetent, confused, misguided, take your pick, but please reject this motion.